with our guest, Professor Anu Sharma, today. Before I begin my questions, I would like to thank her for accepting our invitation. It's an honor to make an interview with you. So my first question is, how did you meet audiology?
So thank you first for inviting me to this interview. It's always a pleasure to talk with faculty and students from universities in other countries, and Turkey is such an important country where audiology is concerned. How did I meet audiology? So, I actually grew up in India, and I did my bachelor's in both audiology and speech pathology because we had a combined bachelor's in India. And in the course of my studies, I found that I was more drawn to audiology. I was more fascinated by audiology. So I decided to pursue audiology instead of speech language pathology. And I applied to come to the United States for graduate studies in audiology. And then I moved to the United States and finished all my studies in audiology.
So that's how it happened. My next question is, in your opinion, is only audiology education sufficient to succeed in the field of audiology? If not enough, in which areas should we support ourselves?
This is a really good question. I think any field, including audiology, is enriched by getting ideas from other related fields. And so, for example, in audiology now, there's a lot of talk about this relationship between age-related hearing loss and dementia, for example. And so if audiologists have some expertise in cognitive screening, for example, or cognition, how to test cognition, that's something that they can use in their field and serve their patients better using that. Similarly, we know for something like tinnitus, for example, cognitive behavioral therapy has been useful. And so it's possible that if we had some little background or expertise in things like psychology or behavioral therapy, we might be able to do better rehabilitation for our patients. So yes, I do think that we should get expertise and ideas from other fields. And conversely, we can also contribute expertise and ideas to other fields.
Thank you. My next question is, what will you advise to audiology students about their careers? What path should they follow in career planning?
Yeah, so that's a really interesting question. I think what I would advise students is find an area of audiology that fascinates you, that really fascinates you is the right word. Like, for example, I was fascinated by the brain. I was a young student like you, and I didn't know very much. I just knew the brain fascinates me, the mysteries of the brain. And I didn't know how I would bring it into audiology or what exactly I would study in it, but I was always drawn to the brain. And now I have a career studying neuroplasticity. So that's probably the advice I can give you from my experience is find the area that fascinates you, because then you will always be interested in it,
Thank you. My next question is, what are your suggestions for making a difference in the field of audiology?
Yes, so I think every single one of us as clinicians or researchers can make a difference in the field of audiology. And to me, the way we can do it is by seeing the whole patient. So we shouldn't just think about the medical history or the audiological history. With adult patients, we might want to look at their social circumstances, how we should be treating the whole patients, or with children, their educational circumstances. And so if we keep the whole patient in mind, as opposed to just the ear or just the ear and the brain, we will be doing better service for our patients. And if we If we do that, then I think we can make a difference in the field, one patient at a time.
Thank you. My next question is, could you share your 3 golden rules for life in general?
Yeah, I don't know if I have 3 golden rules, but I have one golden rule that I really live by. And that is, we should articulate our values. And once we articulate our values, we should live by them. And so when we have to make very tough decisions, as we all do in everyday life, if we make those decisions based on our values, then we're likely to make decisions that we can live very comfortably with, and that will cause us a lot less stress in life. So that's kind of what I live by.
Thank you. My last question is, what are your expectations from young people in the field of audiology?
So I have wonderful expectations from people like you in the field of audiology that are going to take this profession forward. I think what I would love is for future students to think out of the box, to be innovative, both in clinical service, in how we treat our patients, but also in research. Let's think innovatively, and that will really move the field forward. Let's go beyond audiology to move audiology forward.
Thank you. So that was it. Thank you, Mrs., for participating to our People Contributing to Audiology project. We have been enlightened from experience and advices.